Good morning. I'm Dean Percy, and I'm a member of the Department of Pathology at the Ontario Veterinary College at the University of Guelph in Guelph, Ontario. And I'm very pleased to be a participant in this program. The first presentation will deal with the spontaneous diseases and the pathology thereof in laboratory mice and rats. Could I have the first slide, please? Some of the diseases which occur in laboratory mice. Diseases of the skin. This animal exhibits a lesion in the muzzle region that could well be due to barbering, or another possibility would be that this animal actually was housed in a cage that had sharp edges, or the water had sharp edges and was actual mechanical abrasion that we're seeing in this lesion. This is a classic example of barbering in mice. If we look at the animals to the right with obvious denuding of the muzzle region and a bilateral distribution, and look at the culprit up here in the upper left that has been doing the barbering. So a good example of barbering in mice. One of the principles in mouse husbandry is to ensure that male mice, once they reach puberty, are not housed together. And here's a typical lesion that we see in male mice that are housed together, where we have a fighting injury around the base of the tail. These injuries and abrasions may well occur along the back and other areas, but the tail is a prime area for these lesions. An example of a ulcerative weeping dermatitis in the area of the back between the ears, and a couple of possibilities here would be a staphylococcal infection of a coagulase positive staph, or another possibility would be that we have an example of pruritus with excoriation and eventually an ulcerative dermatitis due to a mite infestation that has resulted in severe pruritus and self-inflicted scratching in this area. And in this case, it is an example of mite infestation, and this preparation of the pelt of an infected animal is examined under a dissecting microscope, and you can see that there are large numbers of mites in this specimen. So a good example of cutaneous acariasis in mice. The C57 black is a classic example of a strain of mouse that develops an acute hypersensitivity to mite infestations on occasion. In this specimen, we have multifocal ulcerative dermatitis, in some cases coalescing with adjacent areas, and this was an example of mite infestation that resulted in a hypersensitivity. It's important, though, to emphasize that in the case of the C57 black mouse, that sometimes these cases of ulcerative dermatitis are idiopathic, and there have been reports of this condition due to a immunologic vasculitis that resulted in lesions of this type. This is just a reminder that in the case of rodents in general, that you often see large numbers of mast cells associated with the inflammatory response. In this case, a C57 black mouse with an ulcerative dermatitis and large numbers of mast cells in the underlying dermis. A good example of ringtail in a young mouse. The usual scenario in the case of ringtail is that these animals develop this constriction, sometimes a singular annular constriction, sometimes multiple constrictions of the tail, usually early in life, often during the suckling period, and this has been associated with low humidity. Humidity around 20% or lower you're very likely to develop this problem in your colony of mice. This hairless mouse is not a nude mouse. It's fully immunocompetent, but it's one that does not possess hair, and it's just to emphasize and demonstrate the types of lesions that we see in cases of mouse pox. We have multiple raised to ulcerative lesions over the many areas in the body due to ectromelia virus infection. And histologically, if we were to take a biopsy of skin from one of those actively infected areas, we should be able to identify intracytoplasmic inclusion bodies as we see in this preparation. So mouse pox due to ectromelia virus and typical intracytoplasmic inclusions in the skin. Other manifestations in the skin of mouse pox, often in animals that survive for several days, we'll see a scaling dermatitis in the eye region, as we see here. And often lesions occur in the tail in animals that survive for several days. We can see that we have several annular to focal lesions throughout the length of the tail. And to remind you that the term ectromelia was first used to denote the fact that some of the animals that survived actually had sloughing of extremities. And here's a good example where there's been a loss of the tip of the tail in this animal that survived a infection with ectromelia virus and developed the typical lesions of mouse pox. Just to remind you also that visceral lesions are common in animals, in strains of mice that are susceptible to this virus infection. And multifocal hepatitis and also splenic necrosis are common conditions seen in the visceral organs in a case of ectromelia virus infection. This is a condition that occurred in our facility a few years ago. These are young skid mice, in other words, severe compromised immunodeficient animals. And in this case, we had suckling animals that were approaching weanling age that had sloughing of the extremities. And on closer examination, we determined that there was actually wrapping of cotton batten bedding around the extremities that resulted in ischemic necrosis and eventually dry gangrene and sloughing of the extremities. Respiratory infections in mice. The most commonly encountered respiratory infection in this day and age is Sendai virus infection. And in this specimen, we have the typical lesion seen in an animal during the acute stages of Sendai virus infection, demonstrating the consolidation around the hilus of the lung and in some areas extending down to the tips of the lung, a cranioventral distribution on of the lung on the right. So the number one candidate here would be an acute Sendai virus infection. And histologically, the typical lesions that we see with Sendai virus infection in susceptible strains of mice are a marked bronchitis and bronchiolitis. There's a marked proliferative reaction taking place in airways in this slide, and at higher magnification to demonstrate the marked metaplasia of epithelial cells lining airways during the acute stages of a Sendai virus infection in this strain. And this happens to be an example of Sendai virus infection in the DBA strain that are notoriously susceptible to Sendai virus infection, and these are the typical lesions that we see. In contrast, it's always risky, granted, to make a differential diagnosis of a viral infection strictly by histopathology, but one of the differential features of Sendai virus infection in mice compared to pneumonia virus infection in mice is the fact that with Sendai virus it tends to localize normally in the airways, whereas with PVM or pneumonia virus virus infection of mice, we often do see a marked reaction at the alveolar level. And in this case, there's a marked alveolitis in this animal that's infected with PVM. And to confirm the presence of the virus, immunoperoxidase preparation to demonstrate the presence of viral antigen within the epithelial cells lining the alveoli, many of which are probably type 2 pneumocytes. This preparation is from a skid mouse infected with PVM, and understandably they're notoriously susceptible to this virus infection, as they are to many other infectious agents. This is a condition that we do not see routinely in this day and age, but was relatively common a few decades ago, and that's chronic murine pneumonia in a mouse. The lungs exhibit the typical features that we see with chronic murine pneumonia. There's consolidation, there's discoloration, there's a cranioventral distribution of the right lung, and these are the hallmarks of a chronic murine pneumonia associated with Mycoplasma pulmonis infection. The other feature that we often do see with a chronic Mycoplasma pulmonis infection, whether we're dealing with laboratory mice or laboratory rats, is otitis media. And this is a good example of bilateral otitis media in an animal infected with Mycoplasma pulmonis. And in addition, this animal did have lesions in the upper and lower respiratory tract. Pulmonary tumors. This is an example of a large bronchiolar carcinoma. There is a clear delineation of the tumor with the adjacent relatively normal parenchyma. It's protruding above the surface, and in some cases, if these are allowed to proceed, they will ulcerate through the pleural surface and implant into the pleural cavity. Another example of a primary pulmonary tumor in a laboratory mouse, in this case sparing of the lung on the right and large raised lobule and involvement of the adjacent pulmonary tissue on the lung on the left. And histologically, there are two types that are identified: the so-called bronchiolar carcinoma, or the Clara type tumor. As we see here, we see papillary structures lined by cuboidal epithelial cells. That's a typical picture that we see with Clara cell tumors or bronchiolar tumors. In contrast, the alveolar cell tumors tend to line alveoli and tend to be low cuboidal in appearance on H&E staining. So just to emphasize that the two types of pulmonary tumors in mice, the alveolar type, which appear to arise from type 2 pneumocytes, and the bronchiolar type or Clara cell type, and both types are common in old mice, and they're not normally virus associated. This is an example of a florid case of mouse hepatitis virus infection. This is an athymic nude mouse that was doing poorly and was eventually euthanized, and the lesions seen on gross examination were twofold. The liver is swollen. There's multifocal pale areas on the liver, multifocal to coalescing. There are areas of hemorrhage, and in addition to that, there's evidence of hemorrhage into the gastrointestinal tract. So the typical lesions that are seen, the typical hepatic lesions that are seen in an active case of mouse hepatitis virus infection. And again, to emphasize that athymic mice are notoriously susceptible to this virus infection. Histologically, the features that we look for are as follows. In the liver, we often see basophilic granules that are interpreted to be nuclear debris from degenerating infected cells, and also the presence of multinucleated giant cells or syncytial giant cells, and this is a good example in this area. And again, to emphasize, like most envelope viruses that many can cause fusion of the adjacent virus-infected cells because of the alteration of the cytoplasmic membranes, and the end result is the syncytial cells. So it's certainly a useful criterion on H&E stain preparations in cases of focal hepatitis to indicate that this is a good candidate for most hepatitis virus infection, coronavirus infection. So just to reiterate some of the target areas with most hepatitis virus infections, it's unfortunate that we're saddled with the name most hepatitis virus because there are a variety of other tissues that may be affected. In addition to the liver, the central nervous system, a non-suppurative encephalitis, lymphoid tissue, intestine, and also the respiratory tract. This is a skid mouse, a severe combined immunodeficient mouse that developed a multifocal hepatitis. The lesions are irregular, they're pearl gray in color, and they're linear to focal. There are various stages of development. This animal also had a suppurative peritonitis. So the differential features here, comparing this with a virus infection such as most hepatitis virus, these lesions tend to be larger. They tend to be irregular and linear in distribution in some cases. And histologically, this is the type of liver lesion that we saw with this outbreak of disease. A very clearly delineated area of coagulation necrosis, and frequently we're able to demonstrate thrombosed vessels adjacent to these affected areas. So minimal inflammatory response. And by electron microscopy, large numbers of bacilli were seen in association with the hepatic lesions. And on culture, it was we isolated pure cultures of Proteus mirabilis. So this is an example of acute Proteus mirabilis infection in immunocompromised animals. And just to emphasize that immunodeficient animals are most at risk. In this case, they were skid beige mice that were affected. And the lesions seen were multifocal hepatitis, splenomegaly, peritonitis, and pneumonitis. And again, just to emphasize that coagulation necrosis and septic embolization were striking features of this infection. So just to reiterate, with focal hepatitis in mice, certainly MHV, mouse hepatitis virus, Tizer's disease, and in immunocompromised strains, certainly Helicobacter is another possible candidate. Reovirus infection, reovirus 3, especially in infant mice, and other bacterial infections such as Proteus and Salmonella would also be candidates under certain circumstances. Litter mates, one of which is obviously nursed recently, has a stomach filled with milk curd. In contrast, this litter mate is thin, very dehydrated, and histologically in the small intestine, this was the pattern of disease seen on H&E stain preparations. There was blunting of villi, there's marked vacuolation of enterocytes lining the tips of the villi, almost bordering on balloon cells, and some semblances of syncytial cells as well in the affected villi. So the typical appearance that we see with a coronavirus infection, in this case, most hepatitis virus infection. Again, emphasizing that there are many identified enterotropic strains of most hepatitis virus that can cause infantile diarrhea and give you the picture that we're seeing in this preparation. Another possible cause of enteritis in infant mice. These animals have soiled perineal regions and also soiled tails, indicating that they have active cases of diarrhea. And by immunohistochemistry, this was identified as a rotavirus infection. Again, to illustrate the fact that with rotavirus infections in mice, although the mortality rate is lower, there still are usually striking lesions in the small intestine. And in this case, with immunoperoxidase, emphasizing that there's viral antigen within the cytoplasm of enterocytes lining affected villi. So an example of diarrhea in infant mice due to rotavirus infection. This is a preparation of reovirus 3 infection in suckling mice. Again, to emphasize the marked vacuolation of enterocytes, especially those at the tips of the villi, and to re-emphasize that with rotaviruses and with reovirus, and also with coronavirus infections of the alimentary tract, that they tend to localize and replicate in the relatively well-differentiated cells at the tips of the villi. So looking at this by H&E, it would be impossible to differentiate this from a rotavirus infection that could either be reovirus 3 or conventional rotavirus that's accounting for the lesions that are seen in this preparation. Juvenile mice, the normal mouse on the right and the affected mouse on the left. It may not be too obvious here, but there's some thickening of the lower alimentary tract in that thin mouse on the left. And if we compare the cecum and descending colon in these two animals, normal lower alimentary tract on the right and affected on the left, you can see the marked enlargement and thickening of the wall of the descending colon in the affected animal on the left, and also enlargement of the cecum in that animal as well. Histologically, the hallmarks of a hyperplastic colitis, there's marked hyperplasia of the entire thickness of the wall. There are increased mitotic figures in the crypts of this specimen, and there are also a few inflammatory cells in one of the dilated crypts seen in this preparation. So these are good examples of murine colonic hyperplasia, and the pathology, mucosal hyperplasia of the descending colon, and erosions and ulcerations may occur with leukocytic infiltration, and the lesions certainly regress in survivors, and Citrobacter freundii is recoverable only during the acute stages of the disease. So Citrobacter, a specific strain of Citrobacter freundii, is involved in these outbreaks of disease, and in order to isolate the organism, you have to do the bacteriology cultures relatively early in the disease. A good example of rectal prolapse, and in this case, certainly one possible candidate would be transmissible hyperplastic colitis due to Citrobacter. Another possible candidate would be pinworm infestation, and there's certainly other causes of this condition, but those would be prime candidates to result in rectal prolapse. Heart from an old mouse with chalky deposits on the epicardium, circumscribed to coalescing chalky deposits on the epicardium. The typical appearance that we see on gross examination with mineralization. And histologically, the degeneration of myofibers and the deposition of mineralized material within the degenerate areas of heart. So the term myocalcinosis, or spontaneous myocardial mineralization, is common in certain strains of mice, such as the DBA strain, and in some colonies there may be a high percentage of animals that may be affected by 3 months of age. The etiology here, the etiopathogenesis, is still very much in doubt. suggested to be a metabolic disturbance, and features are degeneration of myofibers, fibrosis, and very characteristic mineralization. Amyloidosis. Amyloidosis is relatively common in certain strains of old mice, and this is an example of glomerular involvement where we have deposition of homogeneous eosinophilic material in the glomerular tufts. Amyloidosis can have a variety of tissue tropisms. In this case, marked deposition of amyloid in the lamina propria of the small intestine. Certainly liver and spleen are other candidates as well in cases of amyloidosis in mice. This is something you're very unlikely to see in this day and age, but it just to emphasize again that in the years ago when chloroform was used either to anesthetize or euthanize animals, that certainly one of the features that was seen in survivors was acute nephrosis. Comparing the kidney to the right, that is from an animal that was anesthetized with chloroform 48 hours before the necropsy was done, you can see the marked, the pale appearance, the marked swelling of the kidney compared to a control litter mate to the left. And male mice were particularly at risk and particularly susceptible to chloroform-induced nephrosis. Moving on to the reproductive system, mammary adenocarcinomas, and in this case we have a large mammary adenocarcinoma in the axillary region with very distinct lobulations and separated by connective tissue. The usual appearance that we see with mammary adenocarcinoma in laboratory mice, and certainly in some strains of mice, it's very common to see spontaneous tumors as early as 9 to 12 months of age. Thelma Dunn many years ago classified these into A, B, and C. In this case, we could classify this one as a type A, since they're relatively uniform acinar structures lined by relatively well differentiated epithelial cells, so that there are several different classifications that are still used today to classify these neoplasms by H&E stain preparations. And just to remind you that most mammary tumors in mice are associated with retrovirus infections. Most mammary tumor virus, and there are several different strains that have been identified, and in this case typical B-type virus particles that are seen budding off the cytoplasmic membrane of a transformed cell. An old retired breeding laboratory mouse demonstrating impaction of the accessory sex glands. These seminal vesicles are markedly enlarged and filled presumably with inspissated material. Another feature here that can be seen quite readily is the divisions in the stomach, the glandular portion and the squamous portion of the stomach that's typical of in small rodents. So impaction of the accessory sex glands in a retired breeder mouse. Neoplasms of the hematopoietic system. This large mass in the mediastinum is an example of a thymic lymphoma. This happens to be a skid mouse, and it's not too unusual to have 15 to 25% of these animals, if they're allowed to live to old age, that will develop spontaneous thymic lymphomas. Another example of a lymphoma, probably a B-cell type lymphoma, marked enlargement of the cervical lymph nodes and also the axillary lymph nodes. There are also histiocytic sarcomas or reticulum cell sarcomas that are seen as a spontaneous event in certain strains of mice. And again, many years ago, Thelma Dunn classified these into reticulum cell sarcoma A, B, and C. More recently, the term histiocytic sarcoma is more commonly used. This would be an example of a type A reticulum cell sarcoma where we have a relatively homogeneous population of relatively poorly differentiated cells with fibrillar cytoplasm and prominent nucleoli. In contrast, in this preparation we have a more heterogeneous population varying from relatively poorly differentiated cells with large nuclei to an infiltrate of cells that resemble lymphocytes. And in this preparation, we have, in addition to identifiable lymphocytes, multinucleated giant cells and a very heterogeneous population. This would be referred to as a histiocytic sarcoma, reticulum cell sarcoma type B. Another term that's been used for these is follicular center cell sarcoma, where there's a mixed population varying from reticulum type cells to lymphocytes. So malignancies of the hematopoietic system in mice, we have thymic lymphomas, non-thymic lymphomas, or so-called B-cell tumors, rarely myelogous leukemia, and certainly histiocytic tumors as well. A urethral plug seen in the entrance to the penis in this animal, and this is interpreted to be material from one of the accessory sex glands, and usually this is regarded as a terminal event and an incidental finding. It's only if there was evidence of obstruction upstream that we would consider this to be a significant finding, considered to be just a incidental finding at post-mortem urethral plug. Just to emphasize that we do see other types of spontaneous tumors in mice as well. This is an example of an osteogenic sarcoma, and sometimes these do metastasize to areas such as lung. So there are a variety of other tumors that can be seen on occasion in mice, including tumors of this type. We're moving on to the rat, a Long Evans rat with a large family of pups. Skin conditions in the rat, barbering. Again, we have a variety of patterns. In this case, it's along the ventral surface, and this one is likely to be a self-induced case of barbering and not by a cage mate. This is a condition we see occasionally, sometimes as sort of mini outbreaks of the disease. In this case, young adult Sprague Dawley rat with bilateral ulcerative lesions in the interscapular region, with some evidence of hemorrhage and crusting here as well. These have been associated with a coagulase positive staphylococcal infection, although this is probably not the entire story, because certainly in some cases we can isolate the organism from other animals that are not affected, and it's very likely that there are other factors that are involved that result in this disease. There's certainly a consensus that these lesions are primarily self-induced, and that the probably because of the intense pruritus, the scratching of the hind legs is resulting in these ulcerative lesions that we see with this condition. And histologically, from a case of ulcerative dermatitis in a young adult rat, evidence of ulceration and fibrinous exudate on the surface, but in this case, to emphasize that no evidence of bacterial colonies, so that there's still a lot to be learned about this spontaneous outbreak of ulcerative dermatitis in rats. A rat with two circumscribed lesions that are scaling on the skin, and certainly a number one candidate here would be dermatophyte infection. Another possibility, of course, would be ectoparasite infestation. This was an example of ringworm of dermatophyte infection, and the causative agent was trichophyton. And on this silver stain preparation with methenamine silver, large numbers of organisms. You can see the arthrospores that are investing the hair follicle and surrounding the hair shaft. So dermatophyte infection in a laboratory rat, not a condition that we see very often in this day and age. A good example of ringtail in a young rat, again in rats as in mice, associated with primarily with low humidity and a very distinct annular constriction at the base of the tail, and several constrictions extending down to the tip of the tail. And there's not much doubt, had this animal lived, that there would have been sloughing of the tip of the tail because of the dry gangrene that's evident at the tip. So ringtail in a rat. Chromodacryorrhea in a rat, characterized by this staining of red-brown pigment around the eyes, and sometimes we see the same condition extending to the external nares. So the possibilities here certainly would be an infectious agent such as chronic respiratory disease, SDA virus infection, stresses such as shipping or long-term manual handling. Any of those conditions may represent a stress that would be sufficient enough to result in the release of the porphyrin dyes from the lacrimal glands. And the simplest way to demonstrate that this is in fact porphyrin and not blood is to use the ultraviolet light, and you can see the typical pink fluorescence with these porphyrins under ultraviolet light. This large mass at the base of the ear and extending down to the jaw is lobulated, hemorrhagic areas, a yellow discoloration varying from yellow to pearl gray in some areas, is an example of Zimbel's gland carcinoma. These are tumors that arise from the glands at the base of the ear in rats, and sometimes get to be very large size, as we see in this case. If we look at these histologically, there's a variety of patterns of disease that may emerge. They may be primarily squamous in type, squamous cells, and or they may, as we see here, or in some of these tumors, it may be primarily holocrine glands, sebaceous type glands that make up the neoplasm. So there's certainly a mixed population of cells depending on the tumor that you're examining by H&E. So Zimbel's gland carcinoma. Respiratory infections in rats. This animal has a very striking cranioventral bronchopneumonia with consolidation of the anterior lobes of the lung, with some mottling of the caudal areas as well. This is an advanced case of this same disease, chronic respiratory disease, chronic murine pneumonia. There are a lot of terms that are used for this infection, this condition. And this is an advanced case of chronic murine pneumonia where the right lung is extensively affected, and we see multiple raised areas on the right lung that at this point in time are essentially areas of abscessation. Just to remind you that the airways of rodents in general do not have a lot of supporting tissue around them, so that if you have a chronic bronchitis with stasis of exudate, that eventually there will be weakening of the wall and eventually progress to bronchiectasis. And essentially at this point in time, these are just areas of abscessation in areas of bronchiectasis that are essentially non-functional at this stage of the disease. And the causative agent, certainly that's been recognized now for decades and is still considered to be the #1 candidate is Mycoplasma, and these are the typical organisms, Mycoplasma pulmonis, that orient along the apices of the respiratory epithelial cells and produce effacement and eventually produce the typical bronchitis and effects that are seen on gross examination in advanced cases of this disease. This preparation is just to emphasize the effect that colonization with Mycoplasma will have on respiratory epithelial cells. We have a normal preparation on the left, and on the right, this is a tracheal explant culture 96 hours after inoculation with Mycoplasma to demonstrate the marked loss of ciliated epithelial cells and the loss of cilia in this preparation. So hydrogen peroxide is certainly one of the materials that's elaborated by the organism, but there's certainly other factors that probably are very important in contributing to the disease and to the demise of the animals that are affected with a chronic mycoplasmal infection. So to summarize, with chronic murine pneumonia, Mycoplasma pulmonis is the most frequent isolate, and chronic rhinitis, otitis media, bronchitis, bronchopneumonia, bronchiectasis, and endometritis are typical features of the disease. A few years ago, when we had several breeding colonies with problems with chronic mycoplasmal infection, certainly one of the major problems in these colonies was infertility as well, again emphasizing the fact that the organism can cause an endometritis and certainly result in reduced fertility. The last point to emphasize that opportunistic bacterial infections certainly play an important part in the advanced cases of the disease. Such things as Pasteurella, Streptococcus are examples of opportunistic bacterial infections that may contribute to the disease. This is the last slide coming up on this carousel. More recently, there's been a lot of interest in the role of the carbacillus, the cilia-associated respiratory bacillus, as a contributing factor, if not the primary pathogen, in cases of chronic murine pneumonia. This is an example of a carbacillus-infected airway, silver-stained, Warthin-Starry, large numbers of bacilli that are orienting between the cilia on this surface of respiratory tract, and certainly there experimentally the carbacillus as the sole pathogen can produce disease that's indistinguishable from the chronic respiratory disease associated with Mycoplasma pulmonis, including otitis media. Whether under natural conditions it's as important as Mycoplasma pulmonis remains to be seen, but it certainly emphasizes that it is an important pathogen of the respiratory tract, especially in rats, and in some cases acts as a co-pathogen together with Mycoplasma pulmonis. Other bacterial infections of the laboratory rat. In this case, we have a juvenile rat that died suddenly with acute respiratory infection. At necropsy, there's marked fibrinous exudation on the pleural surfaces and some evidence of an acute hemorrhagic pneumonia within the parenchyma of the lung. These cases are examples of acute pneumococcal infection in rats due to Streptococcus pneumoniae. The disease is not commonly encountered in this day and age, but at one time was relatively common in laboratory rats. This slide of cerebral hemisphere showing the leptomeninges is just to emphasize that with pneumococcal infections that they may take a variety of patterns of disease. It may be confined primarily to the lower respiratory tract with acute fibrinous pneumonia, with pleuritis. There may be a polysericitis, but in some cases the lesions may be confined to the leptomeninges. A few years ago, when we saw a substantial number of these cases, it wasn't too unusual to do a necropsy on an animal and find very little on gross examination when examining the thoracic and abdominal viscera, but when on removing the calvarium to find that there was a suppurative meningitis. So acute pneumococcal or streptococcal infection in laboratory rats, not a condition that we see often in this day and age. This is another bacterial infection seen on occasion in rats, usually in animals that are immunocompromised. And in this case, we have an old Long Evans rat that was euthanized in extremis, that has multiple circumscribed raised areas throughout all lobes of the lung, and some of these lesions appear to have a hemorrhagic border around the individual lesion. So multifocal suppurative lesions within the lung in this rat, and this same animal also had multifocal suppurative lesions in the renal cortices and extending down into the medulla. This is an example of CORYNEBACTERIUM KUTSCHERI infection, or so-called pseudotuberculosis. The points to be raised here and emphasized are that this organism may be harbored as an inapparent infection in the respiratory tract in rats and mice, and clinical disease is frequently associated with immunosuppression or experimental manipulation or some identifiable predisposing factor that is going to compromise the immune system. And multiple abscessation in the lung, kidney, and liver are common features of the disease. Histologically, the typical lesion in the lung from an animal with CORYNEBACTERIUM KUTSCHERI infection, large numbers of polymorphs infiltrating into this area, and in some cases the lesions will resemble caseation necrosis in the lung and in other tissues. So there's a variety of patterns that may be seen, but certainly the polymorphs are usually a striking feature within the lesions in the lungs and other viscera. This is an animal that had an indwelling jugular catheter that was long, too long, and extending down to impinge on the tricuspid valves of the heart. The end result was a marked vegetative endocarditis, as we see in this slide. So a rat with vegetative endocarditis, and also embolization, suppurative lesions in the kidney as well with this same in this same animal. These are lesions associated with Pseudomonas infection, are referred to as pseudomoniasis. And just to emphasize that it's a common inhabitant of the environment and including the water, and that it's a good example of an opportunistic infection. Usually there are predisposing factors that are identifiable, such as immunosuppression or jugular catheterization. And in this particular case, there was we were able to isolate Pseudomonas from the drinking water and also from the lesions on the heart, emphasizing that there were certainly in that case very identifiable and crucial predisposing factors that resulted in the problem. A young rat that died and was examined at necropsy. There are a couple of features here that are worthy of note. The multifocal to coalescing lesions on the liver, multifocal hepatitis, and also there are pale streaks on the myocardium. This is an example of Tizer's disease due to Clostridium piliforma. And in this case, we have the two of the hallmarks of the disease, the multifocal hepatitis and also the myocardial lesions that are frequently seen with this disease. It's very likely that this animal also had lesions in the terminal ileum, since the three areas are the prime target areas in cases of Tizer's disease: the intestine, especially the terminal small intestine in rats, the heart, and the liver. So this will summarize the some of the diseases seen in mice and rats, and I'd just like to acknowledge contributions made by colleagues at other institutions, including the group at Comparative Medicine at Yale University, Dr. Barthold and his colleagues, and also our other colleagues at other universities that have made contributions to this presentation. Thank you. This is a continuation of the tape on the pathology of laboratory mice and rats. In this case, we will complete the tape with lesions of the rat. These are lungs from a rat with exhibiting dyspnea, and at necropsy there are multiple raised areas on the surface of the lung. They collapse poorly. Their lungs are heavy and edematous, and it's an example of pneumocystis infection. By light microscopy with a methenamine silver stain, large numbers of organisms are seen in the alveolar spaces. Some of these are the cystic forms, and also there are probably trophozoites in here as well. So in this case, the rat was given a protein deficient diet that contributed to susceptibility to pneumocystis infection. So just to emphasize that pneumocystis carinii is fairly commonly found in the environment, apparently, among laboratory animals, and certainly if there are identifiable predisposing factors that may compromise the immune response, such as steroid therapy, or in this case, a protein deficient diet, these animals may develop the typical lesions associated with pneumocystis infection. And histologically, in addition to the presence of the organism, there is an interstitial pneumonitis with lymphocytic infiltration and pulmonary edema. An old rat with subpleural histiocytosis. These alveolar histiocytes that are aggregating in focal distribution in the subpleural area in the lung are relatively common in old rats. So alveolar subpleural histiocytosis. Malocclusion in the rat. Again, to emphasize the importance of good alignment of the incisors, otherwise there's overgrowth, as we see here. And again, to remind you that there appears to be a definite genetic predisposition, and certainly a little genetic counseling would be a wise move in this case. So malocclusion. Two rats, normal on the right with normal submandibular salivary glands, and affected animal on the left. There's marked cyaloadenitis with periglandular edema, interlobular edema, and marked swelling of the submandibular salivary glands. The typical lesions that we see with cyalodacryoadenitis virus infection or SDA virus infection. This is an experimentally inoculated animal intranasally, and this is 6 days post-inoculation, and that's the period when we are most likely to see the florid acute lesions such as we see here. Histologically, to again remind you that this coronavirus has a definite affinity and predilection for ductal epithelial cells. There's marked necrosis of epithelial cells lining the duct in the H&E prep on the left, and on the right, fluorescent antibody preparation to demonstrate the presence of viral antigen in the cytoplasm of affected cells. Normal submandibular salivary gland, a toluidine blue stain preparation. Contrast that with the next slide, which is a submandibular salivary gland from an affected animal at 6 days post-inoculation to demonstrate the coagulation necrosis of the ductal epithelial cells and the marked interstitial edema and some evidence of degeneration of epithelial cells lining acinar structures as well. So acute sialoadenitis in a laboratory rat due to SDA virus infection 6 days post-inoculation. To emphasize that also there are transient lesions in the respiratory tract. On the left, normal tracheal epithelium, respiratory epithelium with identifiable cilia on the apices of the cells, and to the right, marked hyperplasia and poorly differentiated epithelial cells lining the trachea in an animal at 4 days post-inoculation with SDA virus. So to summarize, SDA or sialodacryoadenitis due to a coronavirus, tropisms for the salivary and also the lacrimal glands, and occasionally we do see cases of megaloglobus in animals during the convalescent period if the lacrimal glands have been severely damaged and are unable to lubricate the cornea in the normal way, respiratory tract lesions, and also to review the clinical signs seen in acute cases of SDA virus infection. Mortality is nil, but certainly there are very striking manifestations of the disease on gross examination and histopathology in animals during the acute stages of the disease. Pinworm infections. This is a Scotch tape preparation applied to the perineal region in a rat infected with Sophacia, and then examined under the microscope to demonstrate the typical egg seen with Sophacia infection in a rat, and the same story would occur, of course, in mice as well. And one of the features we've seen occasionally in these animals is a marked granuloma. Granulomatous inflammatory response in the terminal large intestine in an animal infected with pinworms, and also a few multinucleated giant cells scattered in this preparation as well. So it appears that not only are the parasites causing problems within the lumen of the intestine, but at one stage in their life cycle they may well be invading the underlying submucosa, as we see here. So pinworms in rodents, Sophacia and aspicularis. In the case of aspicularis, the Scotch tape routine does not normally work because the females normally lay their eggs in the alimentary tract, but certainly works well for Sophacia. And also concerns about the possible interspecies transmission with pinworms in rats and in mice. Old rat nephropathy. A kidney from an old rat that is discolored, brown discoloration, pitted areas on the cortices of the kidney. And another example where there's marked discoloration, there's marked pitting, there are ray-like areas extending down into the to the corticomedullary junction in this example of chronic glomerulonephropathy or old rat nephropathy. A lot of different terms are used for this condition. Histologically, to remind you that we do see often marked thickening of the basement membranes of glomerular tufts, and in this case the glomerular tuft is adherent to Bowman's capsule. So to review progressive glomerulonephropathy, certainly renal cortical pitting with discoloration, proteinuria, predisposing factors, age and sex, especially old male rats, strain, predisposition, such as the Sprague Dawley rat, are particularly prone to this condition, and certainly dietary manipulations can increase the incidence as well. High protein diets, high carbohydrate diets are just examples of dietary manipulations that can increase the incidence of progressive glomerulonephropathy in rats. An example of hydronephrosis. This could be a congenital condition, but the other possibility would be if there's obstruction to outflow downstream, such as a neoplasm or whatever, can certainly result in a developmental hydronephrosis. So hydronephrosis. The bladder worm, that's a rare event now in laboratory rats. Trichomozoides crassicata. This rat was a wild rat that was trapped and examined, and we identified the typical appearance of the bladder worm that's seen very rarely in the laboratory rat in this day and age. An example of acute pyelonephritis. This rat also had urinary calculi that may well have been an important predisposing factor, also a hemorrhagic cystitis, and there's evidence of excavation of the pelvis of the kidney of this animal, and also extensive hemorrhage. So acute ascending pyelonephritis in a rat, and it's likely that the urinary calculi in the urinary bladder were an important predisposing factor here. A circumscribed lobulated tumor in the subcutaneous area in a female Sprague Dawley rat. Very distinct lobulations, very nicely encapsulated. A larger example of the same type of tumor, the fibroadenoma in a female rat with distinct lobulations and substantial amounts of fibrous tissue between these lobulations. Histologically, in these cases of fibroadenoma in rats, there's a very prominent collagenous tissue component, and also normally the acinar structures are lined by relatively well differentiated epithelial cells, as we see in this Masson's stained slide. Mammary fibroadenoma, several predisposing factors. Older animals, certain strains such as the Sprague Dawley are particularly prone to this condition. Dietary manipulations and endocrine system. It's been shown, for instance, that prolactin levels may play an important role in the development of these tumors. We not only see them in females, but occasionally we have biopsies submitted from male rats with fibroadenomas. They can readily be removed, but it's likely they will recur at another site within a few weeks or months. These are good examples of interstitial cell tumors of the testes in Fisher 344 rats. The typical appearance of interstitial cell or Leydig cell tumors, they have a yellow cast. Frequently they're hemorrhagic areas. They're distinct lobulations in some cases. These are common in old Fisher 344 rats, and these have also been associated with a concurrent hypercalcemia. And histologically, the typical finely vacuolated cytoplasm of the cells constituting an interstitial cell tumor in a F344 rat. Peritesticular hemorrhage and fibrinous exudation. It's an example of a naturally occurring rat parvovirus infection that are relatively rare, but in this case there was evidence of a periorchitis with hemorrhage. And histologically, with an immunoperoxidase stain, renal tubules, these are tubular epithelial cells of the kidney with very striking aggregations of viral antigen within the nuclei of the cells. Polyarteritis nodosa in old rats. The mesenteric vessels have marked tortuosity and are markedly enlarged. And another example in a rat also with old rat nephropathy and also with increased tortuosity of the mesenteric vessels. Histologically, in the mesenteric vessels adjacent to this section of intestine, you can see the fibrin deposition in the subintimal area, and also the marked inflammatory cell infiltrate in the media of the affected arteries. An example of interstitial fibrosis in the heart of an old rat, a relatively common finding in old rats. An animal with lymphocytic leukemia. It's a Fisher 344 rat. This is a preparation of peripheral blood illustrating a marked leukocytosis. And at necropsy, a Fisher 344 rat with large granular lymphocytic leukemia. There's splenomegaly, there's evidence of icterus, and there's increased size of the liver, and a preparation of the spleen from an affected animal serves to demonstrate the granules seen in the cytoplasm of these neoplastic lymphocytes. At one time were considered to be primarily natural killer cells, but there appears to be now evidence that it's a more heterogeneous population. So large granular lymphocytic leukemia, a common finding in old 344 rats. Leukocytosis, anemia, splenomegaly, hepatomegaly, and icterus. And just to remind you again that NK cells are considered to be the primary cell, although there may be a more heterogeneous population that contribute to the neoplastic process. Histiocytic sarcomas in rats. This would be a granulomatous type with very prominent multinucleated giant cells. An example of hydronephrosis, an example of hydroencephaly, an example of hydrocephalus where we have marked dilation of the ventricles. So a good example of that condition, hydrocephalus. And this is the second last slide. The last slide is coming up. And one of the possible causes of hydrocephalus is this: a very large pituitary gland tumor. And sometimes these pituitary gland tumors reach the dimensions that they actually impinge on the normal circulation of the cerebrospinal fluid, and these animals can eventually then develop a hydrocephalus. The other possibility is that hydrocephalus is a developmental feature and a congenital condition, so there's that aspect as well. At one time, these pituitary gland tumors were considered to be primarily chromophobe tumors, but based on immunohistochemistry, there's a much more heterogeneous population that contribute to the formation of these tumors. So pituitary gland adenoma in an old rat. And that's it.
Stand by.
A review of some of the lesions seen in the Syrian hamster. This hamster has a very roughened hair coat with some hair loss, evidence of a diffuse dermatitis. A scraping was done from this animal, and this was the end result. This is a good example of Demodex infestation in a hamster, just to emphasize that it's been shown that a lot of hamsters are subclinically infected with Demodex mite infestation, but if there are important predisposing factors like old age or anything that will immunosuppress the animal, they may well develop clinical evidence of this mite infestation, acariasis. This is an animal with bilateral alopecia in the flank region, is very obese. It's a good example of Cushing's disease. So just to remind you that Cushing's disease is not necessarily confined to larger animals, that on occasion we do see Cushing's disease in the Syrian hamster. This is a hamster with ulcerative pododermatitis, ulceration of the foot pads, and in this case it was a hamster that was being housed on very poor quality shavings, and on occasion in both the Syrian hamster and the Chinese hamster there may actually be migration of chips into the subcutaneous tissue, resulting in a chronic cellulitis and with ulceration of the foot pads, as we see here. A hamster with multifocal raised areas on the throughout the skin, some of which are ulcerated. And this is an example of an epitheliotropic lymphoma, a section of skin to demonstrate the marked lymphocytic infiltrate in the subcutaneous tissue, simulating mycosis fungoides. A hamster with a soiled perineal region and marked congestion of the small intestine. The usual gross findings that are observed in cases of regional ileitis or hamster ileitis or wet tail, take your pick of terms, and this is the typical picture that we see on gross examination. Just a reminder that there's marked hyperplasia, especially of the ileum. There are several crypts that are dilated and contain inflammatory cells, and also some evidence that there's actual transmural involvement here with mononuclear cell infiltration and the mesenteric attachments. So ileal hyperplasia in the hamster. So hamster ileitis, proliferative ileitis, wet tail. Reminder that weanlings and young hamsters are most susceptible with diarrhea, dehydration, and variable mortality. And the etiology, certainly Campylobacter-like organisms are incriminated in this disease, and a chlamydial organism has also been isolated in some outbreaks of the disease. So it appears that multifactorial, and also there may be more than one organism contributing to the demise of these animals. A hamster with acute typhlitis. A couple of possibilities here would be a uncomplicated Campylobacter infection, or certainly with treatment with narrow spectrum antibiotics can also result in a dysbacteriosis, and these animals may develop an acute fatal typhlocolitis. This particular case is a case of Campylobacter infection in a hamster, spontaneous case, and there's a marked granulomatous enteritis with a very pronounced mononuclear cell infiltrate in the lamina propria and also in the submucosa. Polycystic disease in the hamster is often just an incidental finding in old animals seen at necropsy. There's a cystic area on the liver. There are multiple cystic areas associated with the accessory sex glands in this animal. And this is a hamster with an advanced case of polycystic disease, liver with multiple raised cystic areas filled with clear fluid. So it's seldom that this condition progresses to the point where it compromises hepatic function, but certainly in this case it's very likely that the liver function would be severely compromised. So polycystic disease, usually an incidental finding, clear cysts found in the liver, possibly the pancreas, seminal vesicles, and occasionally the endometrium, and these appear to be blind ducts from embryonic development, and occasionally extensive liver involvement. Polycystic disease in the hamster. A hamster with amyloidosis. The kidneys are enlarged, discolored, with chalky deposits on the superficial cortices, and histologically marked deposition of homogeneous eosinophilic material in the glomerular tuft, and some evidence of deposition in the interstitial region around tubules as well. So to summarize, amyloidosis is common in old hamsters and certain strains of mice. There are a variety of organs that may be affected. And in hamsters, there's evidence that estrogen certainly promotes the deposition of amyloid P, and amyloidosis is more common in female hamsters than it is in males. And just to remind you that amyloidosis does not normally occur in the laboratory rat. Heart from an old hamster that was showing respiratory distress and clinical evidence of cardiac insufficiency. In this case, we have a good example of auricular thrombosis. The auricle and atrium of the left chambers of the heart are usually the areas affected. This is a mural thrombus that's filling the entire atrium in this, or the entire auricle in this specimen. So just to summarize, auricular thrombosis occurs in several species of animals in old age. In this case, the hamster, but certainly occurs in mice and rats as well. A mural thrombus in the left auricle or atrium, and the predisposing factors, certainly if there's myocardial degeneration or arrhythmias, may contribute to the cause, and certainly clinically they may be depletion of the clotting factors. A hamster with lymphoma. See this large mass in the, involving the mesenteric lymph nodes in this animal, and modeling of the liver indicating that there's infiltration with neoplastic cells in the liver as well. And to emphasize that the infiltrates consist of neoplastic lymphocytes. So hamster lymphoma, the epizootics have been associated with a hamster papovavirus infection. And in addition to lymphoid neoplasia, there may also be trichoepitheliomas that have also been associated with this papovavirus infection. So lymphadenopathy and trichoepitheliomas are manifestations of hamster papovavirus infection. The gerbil. Nasal dermatitis in the gerbil. Around the external nares and extending down the muzzle, there are ulcerated areas with hemorrhage. The typical appearance that we see with the nasal dermatitis, that's a relatively common problem in colonies of gerbils. And just to summarize, it's common in the Mongolian gerbil. The lesions may vary from alopecia to ulcerative dermatitis. And the etiology, certainly the most important factor is the second one here, is chemical irritation. And it appears that in gerbils that aren't grooming properly, as the porphyrins are being released from the lacrimal glands and drained down to the external nares, normally they're distributed by grooming over the entire pelage. If this does not occur, then the porphyrins accumulate in this area and cause a chemical irritation and eventually chemical dermatitis and the typical ulcerative lesions that we see in advanced cases of this condition. Tizer's disease is relatively common in colonies of gerbils. In this preparation, multifocal hepatitis, and using a Warthin-Starry silver stain can readily demonstrate the bacilli within the cytoplasm of affected hepatocytes. So Tizer's disease is due to Clostridium piliforma, not spiroforma. Apologies for that. There are a triad of lesions: intestinal, hepatic, and cardiac. And the typical presenting lesions are focal hepatitis, transmural ileotyphlitis, and focal to segmental myocarditis. And intracellular organisms can readily be demonstrated by silver stains. Neoplasms in the gerbil. One of the most common neoplasm is this one. It's a large tumor involving one ovary, and it's hemorrhagic in some areas. There are varying appearances to this fleshy mass. And this is the last slide on this carousel. And histologically, the typical appearance of a granulosa cell tumor. Typical granulosa cells and lakes of blood within this very vascular tumor. A granulosa cell tumor, relatively common in old gerbils. Review of some of the conditions seen in the guinea pig. First, a review of the skin. In this guinea pig with pediculosis, there are large numbers of ectoparasites seen on the pelage. And on closer examination, these are typical biting lice, Gliricola, that are relatively common in conventional colonies housing guinea pigs. An animal with a circumscribed, raised, scaling lesion on the skin that was diagnosed as a case of dermatophyte infection. Trichophyton was the organism involved. So an example of dermatophyte infection in a guinea pig, illustrating the typical circumscribed lesions. So alopecia in the guinea pig, it can be endocrine, parasitic due to pediculosis, or sarcoptic mange is another possibility, certainly mycotic. And in geriatric cases, sometimes for no apparent reason or etiology, we do see loss of hair in older animals. And of course, barbering. A skin tumor in a guinea pig, a trichoepithelioma or a trichofolliculoma, that are tumors that are seen occasionally in this species. Section of lung from a guinea pig, illustrating very prominent perivascular lymphoid nodules. This is a condition that's seen relatively commonly in some facilities, and at the present time it's noted to be, certainly noted on the report, but considered to be an incidental finding unless there is evidence of an infectious process taking place within the lung. There have been studies to try and determine what stimulates the production of this pattern, these lymphoid nodules, but to date there's really no evidence that a single infectious agent is involved in this process. So considered to be normally an incidental finding. I think it's important to emphasize, though, that there are other possible causes of focal lesions within the lung. This is an example of a focal granuloma in the lung of an animal that had received complete Freund's adjuvant sometime in the past. So that certainly Freund's adjuvant can induce focal granulomatous pulmonary lesions, whether we're looking at guinea pigs, rabbits, or whatever, and it's something that should be included in the differential diagnosis depending on the history. A guinea pig with cranioventral bronchopneumonia, marked consolidation of the cranial lobes of the lung with ventral distribution, some mottling of other areas of the lung. The two most likely candidates here would be Bordetella bronchoseptica or pneumococcal infection. Certainly pneumococcus, streptococcus pneumoniae on occasion can give a pattern identical to what we see in this preparation. So histologically, a section of lung from a guinea pig with Bordetella infection. Large numbers of heterophils are present in the lumen of this airway, and there's also evidence of an alveolitis and polymorphonuclear cell infiltration in the adjacent alveolar structures. A young guinea pig that died after showing acute respiratory distress. And in this case, there's an acute fibrinous bronchopneumonia with fibrinous exudate on the pleural surface of the lung. This is the pattern that's most commonly seen with an acute pneumococcal infection in young guinea pigs. And if we do a smear and a gram stain of the pleural exudate, we should be able to identify diplococci that are gram-positive in the preparation. Also to emphasize that with pneumococcal infection, with Streptococcus pneumoniae, acute bronchopneumonia, it's usually a fibrinous type exudate. It's a very necrotizing process and often involves the pleural surface as well. In contrast, usually with Bordetella infections, we do not see a concurrent pleuritis. It's normally confined to the parenchyma of the lung. This is an example of suppurative metritis in a sow that was infected with pneumococcal infection. But just to emphasize that certainly Bordetella infections can also localize in the reproductive tract and certainly is one identified cause of infertility and in some rare cases abortions in colonies of guinea pigs. One other condition that we see occasionally in guinea pigs is acute respiratory disease in very young animals after weaning. The usual history is that these animals have been brought in from a reputable supplier to a conventional facility. They subsequently develop respiratory infections and die. And on gross examination, there may be mottling of the lung. And histologically, there's often very striking evidence of a bronchitis and bronchiolitis, as we see in this preparation. And on closer examination, we can often demonstrate intranuclear inclusion bodies that are basophilic to amphiphilic that are characteristic of this adenovirus infection. So adenoviral bronchopneumonia in guinea pigs, usually younger animals are involved, maybe well be a subclinical infection, and to date virus has not been recovered in cell culture, although the disease has been transmitted from one animal to another using susceptible young guinea pigs. And bronchitis, bronchiolitis, and focal alveolitis and the characteristic intranuclear inclusion bodies are the diagnostic features of adenovirus bronchopneumonia. A good example of malocclusion in the guinea pig. The tongue is trapped within these very long, irregular, discolored cheek teeth. So just to emphasize to you that the cheek teeth in guinea pigs grow throughout life, and if there isn't good apposition of the uppers to the lowers, that you may well have overgrowth, such as you see here, malocclusion, and these animals, of course, are unable to prehend and masticate food in the normal way. So malocclusion. A guinea pig with acute typhlitis, very enlarged cecum with fluid-filled contents and gas formation as well. And this was an example of acute coccidiosis. So looking at a section of large intestine with large numbers of organisms within enterocytes. So acute coccidiosis, not usually a major problem in well-managed facilities, but occasionally we do see outbreaks of this disease in young guinea pigs after weaning, especially if the sanitation is not up to the standards that it should be. And of course, one other classic cause of acute enteritis in guinea pigs is so-called penicillin toxicity, which follows the treatment with an antibiotic that's relatively narrow spectrum, and in this case against gram-positive organisms, resulting in a marked dysbacteriosis and the old dogma was that it was primarily due to this massive increase in the number of gram-negative organisms due to the lack of competition with the gram-positives, resulting in diarrhea, dehydration, and death. But in many cases now it's been identified that Clostridium difficile is the causative agent causing, eventually results in the demise of these animals that have been given a narrow-spectrum antibiotic that results in a dysbacteriosis and eventual acute diarrhea. An impression smear of spleen from a normal guinea pig demonstrating typical Kurloff cells with these Kurloff bodies within the cytoplasm of these mononuclear cells. And Kurloff cells are mononuclear cells that are lymphoreticular in type, and occasionally these Kurloff cells are found in small numbers in the peripheral blood, and the numbers certainly can be increased dramatically by estrogen therapy in both males and females, and large numbers have been identified in the placental labyrinth in pregnant sows. And one intriguing hypothesis is that these cells are actually monitoring and preventing the transfer of fetal antigens to the maternal circulation. So Kurloff cells are unique for the guinea pig, and it's something that we should be well aware of. A guinea pig with bilateral streptococcal lymphadenitis, very enlarged cervical lymph nodes. This one's been incised, and there's purulent exudate flowing from the incised node. They may also occur in other areas of the body. In this case, it's a mesenteric lymph node that's abscessed and contains purulent exudate. So streptococcal lymphadenitis, the etiology is a streptococcus. It's Strep zoo epidemicus. Patterns of disease, usually it's a localized lymphadenitis, but occasionally it will be a systemic infection resulting in pneumonia and occasionally pericarditis as well. An example of lymphoma in a guinea pig. This young adult has very enlarged lymph nodes in the abdominal cavity, and histologically there's a striking infiltrate of malignant lymphocytes in the liver, and so-called cavean leukemia. Young adults are most frequently affected, although certainly there are it's not confined to young adult animals. Certainly older animals may be affected as well. So leukocytosis and lymphadenopathy with splenomegaly and hepatomegaly as well are common features seen at necropsy. And it has been associated with a cavean retrovirus, although certainly C-type virus particles have been demonstrated in non-transformed lymphocytes as well. So been associated with this condition. So whether there are other factors or whether it's the sole contributing factor, I guess at this point in time is unknown. Kidney from an old guinea pig that's pale, has multifocal pitted areas to coalescing areas on the superficial cortex. And histologically, there's evidence of interstitial fibrosis with degeneration of nephrons within this affected segment. And at higher magnification, to emphasize that there's substantial amounts of interstitial fibrosis and there's marked degeneration of tubular structures in individual nephrons. This disease has been termed segmental nephrosclerosis to indicate that it's a nephrosclerosis with minimal inflammatory response. It's segmental in distribution, and it's seen in certain strains of old guinea pigs fairly routinely. Just to go back and reiterate that as far as predisposing factors are concerned, certainly high protein diets will accelerate the disease process, and there's some speculation that possibly ischemic change may result in the segmental pattern that we see with segmental nephrosclerosis in guinea pigs, but still there's much to be learned about the etiopathogenesis of this disease that occurs fairly commonly in old animals in some facilities. An old sow with cystic ovaries, or so-called cystic reedy ovarii. If we examine these cystic areas histologically, they're normally lined by cuboidal epithelial cells with identifiable cilia, and the ovarian tissue in the lower part of this section. In some cases, we may, in addition to the cystic ovaries or cystic reedy ovarii, there may be evidence of tumor formation in other areas of the reproductive tract. In this case, a very large leiomyoma involving the body of the uterus, and occasionally we do see leiomyomas and leiomyosarcomas in old sows. So cystic reedy ovarii in old guinea pigs are remnants of the reedy ovarii and that persist and become cystic later in life. A section of heart and also adjacent lung, and there are several areas, pale areas on the cut surface of this myocardium that are pale, sort of chalky depositions within these affected areas. And in other viscera, in another animal, extensive mineralization involving the serosal surface of this section of intestine, and also the serosal surface of the stomach and the cortices of the kidney. So this has been referred to as soft tissue calcification, or so-called metastatic calcification, or whether it's truly dystrophic or metastatic, I think is still up for argument. It occasionally occurs in animals over a year of age, and there are a variety of tissues that may be affected, as is illustrated here. And one possible contributing factor may be high dietary calcium and low magnesium, although there's still much to be learned about this condition. And there's not much doubt that there is a genetic predisposition, since it occurs much more commonly in certain strains and certain facilities than it does in others. And if there is extensive cardiac involvement, it may actually contribute to congestive heart failure. Pregnancy toxemia, two identified forms of this disease. The so-called nutritional or metabolic form occurs in obese sows in advanced pregnancy, usually carrying a fairly large number of fetuses. And stress factors, number 3 here, is an important predisposing factor as well. Anything that's going to throw an obese sow in advanced pregnancy off feed for a period of time may well be sufficient time to result in mobilization of fat, cessation of carbohydrate metabolism, and the end result is ketosis and the typical pregnancy toxemia that results. This disease is not necessarily confined to obese sows in advanced pregnancy, but experimentally has been produced in obese boars as well that have been taken off feed for a period of time. So histologically, certainly hepatic lipidosis is a prominent feature in the metabolic form of pregnancy toxemia in guinea pigs. And the other form of pregnancy toxemia is the so-called circulatory form. Again, sows in advanced pregnancy, and results in compression of the aorta by the fetuses that actually mechanically exert pressure on the vessels, which results in reduction of blood supply, and will eventually result in uteroplacental ischemia. And it's been recognized to be a possible animal model for human preeclampsia, since the same mechanism is involved in those cases in pregnant humans. So histologically, it would be very difficult to differentiate, since it's very likely with this form that you would have hepatic lipidosis as well, and certainly clinically they're impossible to differentiate without doing special diagnostic procedures. In both cases, ketosis, ketonuria, the hallmarks of pregnancy toxemia. Young guinea pig with extensive hemorrhages involving muscles of the rib cage and also the legs, and another animal with multiple hemorrhages involving the periarticular regions. And histologically, in these cases of scurvy in young growing guinea pigs, one of the features that we look for within the medullary cavity of affected bones are these poorly differentiated mesenchymal cells that are proliferating, and also often we see fibrillar, densely homogeneous eosinophilic material associated with the defective formation of collagen. Again, re-emphasizing that with vitamin C deficiency in guinea pigs that require vitamin C on a regular, almost daily basis in their diet, that the end result with deficiency is the failure to produce normal healthy collagen, and the end result is predisposition to hemorrhage and the formation of poorly differentiated mesenchymal tissue such as we see in this preparation. Guinea pig heart with pale streaks evident in the epicardium. Two possibilities here would be that we have another case of so-called metastatic calcification, or the other possibility would be this. And that's a good example of rhabdomyomatosis, where we have marked vacuolation of myocytes in this guinea pig heart, and they may be evident grossly as pale streaks on the myocardium. If we had the appropriate stain here for glycogen, we could be able to demonstrate glycogen within these affected vacuolated myofibers if it were fixed in the suitable fixative such as alcohol. So normally rhabdomyomatosis is considered to be an incidental finding, but in severely affected animals it's a congenital condition. In severely affected animals it might result in some compromising of cardiac function. And the last slide demonstrates a normal feature in guinea pig lung. These arteries that are seen very prominently here in this section are normal arteries in this species. So the pulmonary arteries in guinea pigs are surprisingly thick-walled. It's a normal feature, and those are good examples of normal pulmonary arteries in the guinea pig. And that concludes the presentation on diseases of the hamster, gerbil,